And now to health. The need to totally roll back the scourge of malaria parasite among children in Nigeria has again taken center stage following the recent NAFDAC approval of R21 malaria vaccine for children under the age of 5 and 36 months to be vaccinated. With R21 vaccine now being certified for its efficacy, there is that hope that the rate of mortality in children will be reduced if all hands are on deck. Correspondent Gabriel Odia takes a look at the impact of malaria parasite on Nigeria in this report.
Back malaria in Nigeria has been a collaborative one as government and other developed partners have evolved ways to work to ensure its total eradication, given Nigerians' poor sanitation system and lifestyles causing devastating effects on families. According to World Health Organization, it reported that a total of 619,000 deaths were reported in 2021 over malaria, while 625,000 deaths were reported in 2020. Experts stated that this new vaccine, malaria parasite, which is leading cause of death among children, will be rolled back.
The vaccine is coming in new, and it took a whole lot of time to study this vaccine or to invent this vaccine, and it was approved by WHO. Now NAFDAC in Nigeria has approved it. Now we are waiting for the Nigerian government to adapt this vaccine into the immunization schedule of children. And this vaccine is meant for children from 5 months to 36 months. So we are now waiting for the government of Nigeria, and then we will see what it will happen. But we are very optimistic that it will reduce, because coupled with other things that I've told you, the seasonal malaria chemo prevention, the use of the LLIN, and then the vaccine, there will be a lot of reduction.
Immunization is very important, and we've seen success stories with polio, with many other vaccines that have been given. You know, all the childhood vaccines and the progress we've made with, you know, having those problems to be of a thing of the past. So with malaria, specific protection with this vaccine will not be different. We are glad that, you know, all the efforts were done, research was put in, and currently it's now found to be safe. And for the bodies who are supposed to vet that it is safe for us have done that, then it's an awesome and a giant stride. And I will encourage everybody, once the vaccines are available, the health facilities, to actually get the vaccines. And this would contribute in no small feat to our, you know, progress towards a malaria-free generation.
While they stated that the R21 vaccine, which is a sterile solution given as an intramuscular injection to prevent clinical malaria in children, however, said before Nigerians begin to see it in large quantity, they must adhere strictly with other medication and proper use of mosquito nets to avert the parasites.
No, the issue is not much. You know, it all depends on states, the strategy that each state has put in place. So as for Benue State, if you look, there's reduction. The only thing is that if you look at the prevalence rate, it's reducing every 3 years. A survey is being carried out, and you see that there's a reduction, while in some places it is increasing again. But then it has to do with attitude again. Some people don't want to sleep inside the nets, and then the environment, keeping the environment clean. And you know, some people will complain that, why is it that in America, in other developed countries, you don't have all this malaria? There are mosquitoes there, only that they are not carrying the parasites. But because of the environment, they keep the environment clean. Like for us to see how the environment is, it's very difficult for even the state government alone to do most of this thing. Individuals have to contribute.
Why malaria is still a problem is that sometimes people actually just take anti-malarials when they don't have malaria. We're supposed to do the test, and then treat if malaria is actually the problem. There's the RBTs, you know, shows that the person has malaria. And then also some people who actually have malaria do not take the medications the way they are supposed to take it. Some medications are twice a day for 3 days. Some will take for 1 day and stop. So resistance happens. There are many environmental things that we need to do to ensure that, you know, our areas do not breed these parasites, the vector of the malaria parasite. However, some of us, our environments are in a very bad condition, and it keeps leading to breeding of this. So we have this problem.
They said malaria parasite, which is caused by female Anopheles mosquitoes, as a result of poor environments are transmitted throughout Nigeria, with 97% population at risk of malaria.
3 months to 59 months, we have there's a strategy that we call the SMC, that's the seasonal malaria chemo prevention, where we give these children drugs to prevent malaria, and it is given at the height of the rainy season, where we treat patients at our various facilities in Benue State. Like in Benue State here, we are supporting 443 health facilities with malaria commodities and testing kits, so that anybody that feels that he has fever, he goes to these health facilities, he's tested, and when it is known to be malaria, he's treated free. These are the strategies that the Benue State government have put in place in terms of prevention.
A lot about malaria has to do with the breeding sites of the vector, where you have areas that puddles of water, where you have areas that, collection of water, and, they have enough breeding sites for this vector. You will have higher chances of malaria being transmitted, both infection and also having possibility of severe forms of the disease as well.
Nursing mothers, pregnant women are advised to avail their children for immunization at respective health centers and hospitals for proper care.